I'd like to ask you about disinformation. There's all kinds of conspiracy theories going around about COVID-19. Charlie Angus, the NDP MP, says he's had to tell his constituents the government does not have a plan to build a network of COVID internment camps. So I'm wondering, what do you think is driving these kinds of theories? Are you concerned about them, and what more can you do to fight them?
We've seen over the past number of years a rise in concerted efforts around misinformation and disinformation on a broad range of subjects designed to undermine people's confidence in their institutions, in their democracies. Some are foreign actors trying to disrupt successful democracies. Others are people with extremist agendas within our countries trying to weaken people's confidence in our institutions and our democracy. As a government, we need to continue to stand strong, particularly during a public health crisis where the best thing Canadians can do can listen to experts, can listen to doctors, can listen to people who are focused on keeping them safe every single day. Whether it's wearing a mask, whether it's keeping your distance, whether it's getting the COVID Alert app, or whether it's eventually getting vaccinated when we have a successful and safe vaccine. These are things that Canadians need to do that unfortunately there is a tremendous amount of noise and harmful misinformation about on the internet. I was chatting with a group of students the other day, and a young woman asked me about COVID internment camps, and I had to explain that as we consume increasing amounts and various sources of information online and around us, we need to continue to be attentive to source. We need to continue to be attentive to comparing various reports and looking for trusted sources like Dr. Tam, like regional public health authorities to tell the truth. We need to hold together and resist people who would sow chaos within our communities and our democracy.
Disinformation as well. I asked the Prime Minister about this. These theories going around about COVID-19. I'm just wondering if these kind of theories, this kind of disinformation makes it harder for you to get your message out, to get Canadians taking your advice seriously.
Well, I think as I reflect on the unprecedented pandemic that we have, it is also, I think, the pandemic that's occurred in the age of social media and many different ways in which information is spread faster than the virus itself. So that is a dual challenge for sure. So misinformation and disinformation does not help public health officials. And so I think we as a collective public health system have tried through various means to provide information like these press briefings, our websites, guidance, etc. But we are aware, of course, that misinformation, disinformation exists. I think there's a part for almost everyone. There's a part for journalists who are in this room to help reveal the sort of tactics and the measures that are at play, including bots and other aspects of what's actually happening in the social media space. There's a role for, I think, internet and social media platforms and companies. So you may want to interview Facebook, for example, or Google, YouTube, Facebook, Instagram. They have put in some measures, and some of them involves actually directing people to the credible sites like the Public Health Agency website if people did certain searches, taking down, sort of demonetizing some of the, quite frankly, outrageous disinformation, and sort of putting them down the list of search engines and that type of thing. So they're trying different tactics, I think, in their own ways. I think, but everybody, I think, can do more. Individuals not only should try and ask themselves, as I said multiple times, of when you look at a piece of information, ask a number of questions, including exactly where does this come from? Is that domain name credible? Can we use those fact checker websites to check before? Definitely ask yourself this question before you forward the information to someone else. So be media smart as well as science smart, if you like. You're sort of everyone is an armchair epidemiologist. Everyone should actually be media smart at this point in time. It's not just for COVID-19, it's actually for health matters in general and vaccines in general, for example. And so I think that, so if you look at the sphere of everyone who's working to help in our COVID-19 pandemic, everyone actually has a role also in the stopping of mis and disinformation. And so I think, you know we can do better in terms of reaching targeted audience in different ways. Today, my message actually was directed to individuals, people who are better than us on TikTok or the Instagram, etc. Because what you want, I would love to challenge people to do is, like, if we had a video on a testimonial from a youth about their experience with COVID-19, is that people who are better on the TikToks and the other places then forward those kind of information. Also, as we put up new information or graphics or videos on putting on a mask, let's just use that as an example. People can use the ingenuity to forward that on better than some of our public health platforms. So I think that's how I see it. But it's a serious issue, for sure.
You think that when a vaccine is developed, that this kind of misinformation, this kind of false information that's circulating out there, do you think that that's going to set back efforts to get more people to take the vaccine in order to boost immunity?
Yeah, and this issue of vaccine confidence precedes the COVID-19 pandemic, and we've been working on various fronts, including looking at social media platforms in terms of combating mis and disinformation. So what we need to do is almost immunize the population against mis and disinformation before the vaccine arrives. And so some of this is actually providing information on the safety and effectiveness measures and the processes that our regulatory authorities undertake, the rigorous processes during this time of rapid vaccine development. So I do think that, prior to the arrival of vaccine work like we are trying to do now and accelerating is extremely important, and that the public should go to the credible sites of information. And we've seen so many sort of media articles, but also other information now about vaccines already that are not credible. And there's many different reasons of why people spread mis or disinformation. And so I think getting a better understanding of that is actually really important, and totally agree. I mean, it is like an immunization of sorts against mis and disinformation that we need.